Hello and welcome to Group 6's presentation on tuberculosis, TB.
General information for tuberculosis. To start off, tuberculosis, other known as TB for short, is a bacterial infection that primarily affects the lungs and other organs of the body, such as the brain or the spine. The general issue in tuberculosis is the bacteria called Mycobacterium tuberculosis, which multiplies and attacks part of the lungs, causing instability for a person who has tuberculosis. This bacterium can easily spread from one person through another, whether that be through coughing, speaking, sneezing, and even from the smallest particles of air that are able to carry the bacteria right into your airway. Although tuberculosis is contagious, it is very likely that you catch it from someone that you live with or work with rather than a stranger, just because they are with you in your day-to-day life. When it comes to the severity of tuberculosis, it can be fatal if not treated, just like any other disease. But it is important to know your HIV status, just because it adds to the overall weak immune system with tuberculosis. On the picture on the left, it is an x-ray of the lungs, and then next to it is a more detailed picture of what the bacterium looks like inside the lungs. And then to the picture on the right, we want to look at the location of the lungs and where they are in our body in correlation to other organs such as the heart and our spine, as previously mentioned. Okay, and now moving forward, we want to talk about tuberculosis and the correlation with the respiratory system. So, the respiratory system is composed of organs and other parts of the body involved in the exchange of oxygen and carbon dioxide, or as we all know, the mechanism called breathing. Parts of the respiratory system include the nose, the nasal cavity, the sinuses, the pharynx, the larynx, the trachea, the lung, and the alveoli. These, of course, aren't all of them, but they are still some of the major parts of the respiratory system. The respiratory system begins when we inhale air into our nose or mouth. This breath of air travels down to the back of the throat and into our trachea, which then gets divided into the air passages called the bronchial tubes. And then a set of healthy lungs, the mechanism of breathing works at its highest potential when the airways aren't corroded with inflammation or excessive mucus, for example. On our picture to our left, we see the sinus, the nasal cavity, and the lungs and such, and where they are placed in our body, and just how the air travels from the mouth all the way to the lungs, and so on and so forth. We see a more zoomed image of the bronchioles, and these bronchioles is exactly where this air is being inserted and exerted. And then next to that same picture, we see an even deeper and more detailed picture of the alveoli, which separates them from the elastic fibers, the capillaries, the pulmonary arteries, and just all in all, what composes the alveolar sac. So all of this down to the alveolar sac are what makes a part of our respiratory system and help us breathe in our day-to-day lives. And now, moving forward, we can connect tuberculosis with homeostasis and pH. But first, we have to know what homeostasis is and how it connects to tuberculosis itself. Homeostasis maintains optimal conditions for enzyme activity and cell function. It maintains a constant environment internally, despite changes in the body that might occur. There are three main components of homeostasis: the receptor, the control center, and the effect. Our body maintains homeostasis by controlling an array of variables ranging from body temperature, blood pH, blood glucose levels, to fluid balance, sodium, potassium, and calcium ion concentrations. The respiratory system and the lungs specifically play a significant role in maintaining homeostasis. This is because as blood passes through the tiny capillaries in the alveolar sacs, there are changes in pressure gradients which allow gases to diffuse in and out of the blood capillaries. The process of gas exchange in the lungs also helps maintain acid-base balance in the body. Thus, the lungs also help maintain the pH level. If the pH level of the blood becomes too acidic, the breathing rate increases, and if the pH of the blood becomes too alkaline, the breathing rate decreases. The decreased breathing rate increases the amount of carbon dioxide in the blood, so the blood pH lowers and comes to normal level. Now, in our slide we see, again, this tuberculosis entering the body and how 90 to 95 of infected individuals will have some type of, we like to call these cavities in the lungs, and these cavities tend to progress. And then next to that, we are here demonstrating that a lung has a pH of 7.4, and the macrophages of the bacterium have a pH of 5.5. And so there's a very much sensitivity regarding the pH and the targeting macrophage and recognition. And so the way they work together, the macrophage is able to pass through and affect the lungs. Meanwhile, there is a receptor that helps them with identifying the macrophage. And so on and so forth. Tuberculosis can obviously become deadly if not treated.
Now let's begin the second half of the disease summary, starting with the history. So the historical background of tuberculosis is as follows. On March 24th, 1882, Dr. Robert Koch, pictured here on the right, announced the discovery of Mycobacterium tuberculosis, pictured on the left, the bacteria that causes TB. He was a German physician and microbiologist known as one of the main founders of modern bacteriology, since he also discovered cholera and anthrax. During the time of his announcement, TB killed one out of every 7 people living in the US and Europe. Although this is the first official medical report of TB in modern times, the earliest written mentions of TB were in India 3,300 years ago and China 2,300 years ago. Next, let's cover the natural history of the disease. If left untreated, those with TB may face the following other conditions. Mild normalocytic anemia can be present in almost half of patients. Pleural effusion, cavitation, lymphadenopathy, airway obstruction, as shown on the picture on the left, pneumonia, as shown on the picture on the right, bronchiectasis, mild leukocytosis, hyponatremia, hypercalcemia, elevated alkaline phosphate levels, mild elevation of liver enzymes, and findings of adrenal insufficiency in case of adrenal gland involvement have also been found, which are low cortisol and aldosterone levels. Now onto the prevalence of the disease. In 2018, 1.7 billion people were infected by TB bacteria, which is roughly 23% of the world's population. TB is the leading infectious disease killer in the world, claiming 1.5 million lives each year. Most of the people who fall ill with TB live in low and middle income countries, but TB is present all over the world. For example, in the image on the left, minorities such as African Americans, Hispanics, and Latinos, and Asians account for more cases than white Americans do. About half of all people with TB can be found in 8 countries: Bangladesh, China, India, Indonesia, Nigeria, Pakistan, the Philippines, and South Africa. This is represented in the image on the right that exhibits the highest rates of TB, which are in southern parts of Africa and in much of Asia. Globally, TB is more common among males than females. Currently, the highest TB notification rates globally occur amongst 45 to 55-year-olds, but in the Western Pacific region, Eastern Mediterranean, and Southeast Asia, TB notifications are increasingly evident in older people, peaking amongst those aged greater than 65 years of age. Lastly, for the disease summary section, the presentation of the disease. The average percentage of patients exhibit the following presentation of TB, which are also listed with their pathologies in the included image. Primary pulmonary TB, which is the resulting lung infection after breathing in air droplets from a cause or sneeze of an infected person, is the most frequent TB manifestation in adults, occurring in about 70 to 80% of cases. A long-term cough, or the coughing up of blood or mucus, is also a common occurrence in addition to extrapulmonary involvement, which may present many years after exposure, which occurs in a variable proportion of cases, about 20 to 45%. And lastly, primary pulmonary TB, extrapulmonary involvement, and other positive laboratory tests of TB are included in the clinical presentation of the disease depicted in this image as well.
The only cause of the disease known as tuberculosis is the bacterium known as Mycobacterium tuberculosis. This pathogenic bacterium usually affects the lungs, but it also may affect the spine, kidneys, or the brain. There is no genetic aspect in contracting tuberculosis. However, tuberculosis is more likely to affect Asians, Hispanic and Latinos, and African Americans more than white Americans. Males are only slightly more susceptible to contracting tuberculosis, as well as adults who are over the age of 65. Although this bacterium is the causative agent of tuberculosis, many people who are infected with this bacterium may actually never contract the disease. There are 3 distinct phases leading to a diagnosis of tuberculosis. First is the exposure stage, followed by the latent stage, and then the active stage. As stated before, tuberculosis can be easily spread through the air when an infected person coughs, sneezes, speaks, or even laughs. The exposure stage occurs when a person has been in contact with or exposed to another person who has tuberculosis. During this stage, the exposed person will test negative for tuberculosis and have absolutely no signs or symptoms of the disease. This stage can last from hours up to years. After the exposure stage, the latent stage occurs. During this stage, a person who has been exposed to the tuberculosis bacterium will still not have symptoms of the disease. At this stage, the bacterium is still inactive and will not affect its host, but they will still test positive for tuberculosis. During the active phase, the person who has been exposed to tuberculosis will now exhibit signs and symptoms of an active infection. This person will test positive for tuberculosis. Some people develop the tuberculosis disease within weeks after becoming infected, while other people may get sick years later when their immune system becomes compromised for another reason. However, many people who have the tuberculosis infection never actually developed the tuberculosis disease. Tuberculosis enters the respiratory system through the mouth or nasal opening. When Mycobacterium tuberculosis is in its active stage, it begins to rapidly destroy lung tissue, creating a small area of inflammation on the lungs known as a granuloma. As the bacterium multiplies, the area of inflammation gets larger and larger, eventually causing extreme damage to the lungs and the airway. The walls of alveoli are very thin, and it is also the site where oxygen is exchanged from the air into the blood. If the tuberculosis bacterium manages to enter the bloodstream, it may cause extensive damage to other areas of the body, including the kidneys, spine, and brain, if the disease is left untreated.
The disease tuberculosis is believed to have a genetic component. The host response to tuberculosis is known to be influenced by genetic and non-genetic variables in both the bacterium and the host. Despite this, little is known about the interaction of these many factors and their impact on the disease progression. Mendelian susceptibility to myobacterial diseases is a category of rare conditions that affects the subset of people who have genetic abnormalities that makes them more susceptible to myobacterial infection. COPD, asthma, and scoliosis are all exacerbated by smoking and corticosteroid use are independent risk factors for tuberculosis infection because they produce airway inflammation, which causes airway obstruction and narrowing, increasing airway velocity and dislodging air to obstructed areas. As a result, airway irritation can prolong tuberculosis infection and lead to tuberculosis disposition and movement to healthy lung regions. In this slide, you can see host-pathogen interaction may be associated with variation in disease severity, and evolutionary newer host-pathogen combinations can make tuberculosis. Connection to lung function, and what is the disease causing not to work properly, and how would this work normally? Lungs are directly exposed to air, having a large surface area, and allow the exchange of gas. They are commonly attacked by bacteria from both the outside and the inside, and as a result have developed unique, highly regulated local immune defense mechanisms that allow for microbial clearance while reducing harmful inflammatory reactions. Tuberculosis must overcome several interaction points which are often hurdles to active respiratory infection. Multiple highly effective host defense strategies such as mucociliary clearance to physically remove inhaled microbes, a secretion of a variety of enzymes, pro- and anti-inflammatory mediators to fight infection, and recognition of microbe-associated molecular patterns by pattern recognition receptors expressed by lung epithelial and myeloid cells. Airway blockage is caused by airway inflammation, which causes airways to narrow, increasing air velocity and displacing air to unobstructed areas. Tuberculosis disease manifests itself in all compartments of the respiratory system, such as nose, sinus, pharynx, trachea, bronchi, bronchioles, and lungs. Tuberculosis must navigate lung anatomy, airway function, and the rules of physics that regulate flow dynamics, size, shape, velocity, and number of inhaled particles in order to infect a cell in the alveolar space. Impaction occurs for larger particles when centrifugal forces drives impaction of droplets against the walls of the upper bronchi. Larger, elongated particles, which are deposited as soon as they contact the airway and cleared by mucus and ciliary cavity, are intercepted. These mucus-coated bacilli are usually evacuated and/or delivered into the stomach, which represents another possible entry point. Sedimentation happens when smaller particles stay in the airways longer and are deposited in the lower bronchi, where airflow is slower due to gravity. Finally, for particles more than 0.5 microns, Brownian motion predominate, and disposition in the lungs is exceedingly ineffective. It's currently unclear how instinctive the size, change, viscosity, surface tension and density, and extinctive speed, concentration, clumping, humidity, temperature features of tuberculosis droplets influence infection and transmission. Airway blockage is produced by tuberculosis-induced airway inflammation, which narrows the airway, swelling of the mucous membranes lining of the bronchi, increasing bronchial mucus production, and slow movement of thick mucus by ciliated cells. Airways inflammation can disrupt the protection, regeneration, and restricting microbial clearance. In this slide, there are two diagrams, one that shows the pulmonary immune response and the brachial immune response. Both show how your body defends itself as infection moves down your respiratory tract. Fluid homeostasis, also known as fluid balance, refers to the process of maintaining a constant concentration of fluids in the body. Osmolarity levels in the blood is how we measure the fluid homeostasis in the body. Plasma osmolality levels measures the body's electrolyte water imbalance. Adults and elderly adults should have osmolality levels of 275 to 295. For children, the range is 275 to 290. More particles in your blood signifies a higher osmolality. The particles are more diluted where the osmolality is lower. Tuberculosis causes hypoosmolality because too much ADH is being produced, making you not urinate as much and retain water. ADH increases the distal nephron water and urea permeability, resulting in the excretion of small amount of concentrated urine, preventing further blood volume loss and restoring normal plasma osmolality. A high level of ADH synthesis results in low plasma osmolality, diluted blood, and a lack of electrolytes, resulting in a lower blood pH. You have an acid-base pH imbalance when electrolyte levels are out of balance owing to dehydration. In particular, your pH levels drop, resulting in metabolic acidosis. In this slide, you can see there's a flow chart where there's a disturbed homeostasis, different things that affect a disturbed homeostasis, and what your body does to restore homeostasis.
So the main symptoms of tuberculosis include feeling of sickness, weakness, or fatigue. There's also going to be unintentional weight loss, fever and night sweats, and chills. So those are some general symptoms. In the slide on the left photo, I included a photo of night sweats. So when you wake up and you're all sweaty. And then as well as the right photo on the right corner, it just shows feeling of sickness or weakness. And then the photo on the right corner just shows like weight loss. And the disease of the lungs itself, the symptoms are going to be coughing, which includes blood or sputum for over 3 weeks or within a 3-week time frame, as well as chest pain, and then pain with breathing. So the photo on the left of the slide just shows the general symptoms in the infographic, so everything I've mentioned. And then the photo on the right shows coughing with blood. So this is more so directed towards like the lungs itself. Their general symptoms overall, including the previous slide, but this one is just towards the lungs because it also affects other parts of the body, which I will be explaining in a few slides. So I found this very interesting. There's 2 types of TB. There's going to be latent TB, which is an infection. Although the bacteria is not active, so you don't have any symptoms. It's also known as inactive TB or just regular TB infection. And most importantly, it's not contagious, but in turn, it could result into active. And then the other type is active TB, which is infectious and you get sick, and it occurs for about weeks or years after the infection with TB bacteria. So some people don't even know that they have it until time progresses. And the photo on the right side of the slide just shows the differences, so what I explained. And then the photo on the left just shows a diagram of basically like what you would expect if you had latent or active. So those are the differences and the 2 types of TB. So as I mentioned 2 slides ago, TB can also affect other parts of the body, including the kidneys, the spine, sometimes the brain. So these are outside of the lungs. And I found it so interesting because in the spine, it could obviously cause back pain, but it can cause progressive bone destruction, which can lead to vertebral collapse, and kyphosis, which is cold abscess formation, and can also compress the spinal cord and cause neurologic deficits. So one time would be pot disease, would be spondylocytis, and the other one, which there is no disc involvement, would be spondylitis. So that's within the spine of what can occur when you have TB. And then in the kidneys, there could be blood in the urine or protein or even pus. And then there's also an absence of bacteria in the urine itself. And you could also experience burning of urine or urinating frequently. And it mostly affects the renal medulla and occurs 5 to 20 years after the lung infection. So these normally occur after the lung infection. And as you can tell, they're a little more severe. I decided to incorporate diagnosis for the presentation just because I thought it was important. So one way you can test for TB is called mantle tuberculin skin test, so TST, and basically a small amount of purified protein derivative, so PPD, is injected under the skin of the forearm, and red bumps will occur if there is a TB infection. And then another type is a blood test, which is interferon gamma release assay, which is IGRA, and that's basically just blood is drawn, then it's sent to the lab. And the photos here, the bottom shows the PPD, and then it shows the TST and the IGRA, so the 2 types of tests used in the middle photo, as well as just the general diagnosis, which is shown on the right. And you can also use x-rays, or sputum fluid tests and CT scans for other infections to view the lungs. And yes, those are the ways to diagnose TB. So the treatment for those who have diagnosed TB, they will just basically have to take different types of drugs for about 6 to 12 months, depending on the severity of the case. And those drugs are going to kill the bacteria, which is caused by Mycobacterium tuberculosis. And if they're taken incorrectly, the person can become sick again, or the germs that are still active and alive may become resistant to the drugs. So the types of drugs that these patients would take are called Hyzid, Rifidin, Ambutol, Zinamide, and a combination of isoniazid and rifapentine. And they have to be taken properly every day on time for the bacteria to be killed. And I actually found the side effects of some of these. So those would include tingling or numbness in the hands or feet. You could have upset stomach, nausea, loss of appetite, itchy skin, changes in eyesight, so that could cause blurry vision, yellowish skin and eyes, and then dark colored urine as a result of taking these drugs. And then for prognosis, the treatment success rate is about 90%. Researchers have found that those who have survived active TB will have a lower life expectancy than those with latent. As I mentioned earlier, the difference between active and latent was you actually have the infection with both of them, but one of them you don't experience the symptoms. And that could cause losing 3 to 4 years of life. And then after successful treatment, it's possible to get a reinfection, and that would most likely be due to the fact of smoking, lung disease, and drug abuse, or if the patient carries HIV. And without early treatment or finishing prescribed medication, one can suffer lifelong damage to lungs, and without anything, it could be fatal. So in this photo, I interpreted a picture of no smoking, and then I found this really cute photo of lungs, and it says exercise is a vital part of tuberculosis recovery, to get the lungs active and working again. And yeah, thank you for watching our presentation.
Thank you so much for watching our presentation on tuberculosis, TB. Here are our references.